A peaceful and prosperous new year to all, and thank you for spending some time with me. This is Sam Collins, the coding and billing expert from the American Acupuncture Council, and today's show is to the point on some billing and coding. You can see on the front page here coming up on the slides some information on my email and where to contact me. But again, thank you for spending some time with us. So let's get to the slides and let's see what's going on with coding and billing. So you can see here's our basic information, my email, and our website for seminars and programs. That being said, let's talk a little bit today about evaluation and management codes. Evaluation and management codes are, of course, the codes we use to indicate an examination of your patient. For the most part, that's how people think of it, but I want to today talk about it being also a management code. So let's first deal with this first aspect of E&M and talk about what's a new patient and an established patient. And you'll see here there's both codes. On the left side, new patient. On the right side, established. And as I'm sure most are aware, a new patient is someone brand new or someone you have not seen in 3 years or greater. Whereas an established patient is an examination of a patient that you have seen prior or within 3 years, which clearly means any re-exams and so forth. Special note, just because a person is involved in an accident or a new injury doesn't make them a new patient. New patient deals solely with whether or not you have seen the person before or you have not seen them in 3 years or greater. Now, how do we define an acupuncture visit? Because often you'll hear people say, well, I want to use an office visit code. And they think of the E&M codes as an office visit. And I want to kind of end that because an office visit is more than just evaluating a patient. An office visit can have many facets in an acupuncture setting. It can include the evaluation of your patient, meaning the pre-service, how are you feeling today, the exam, the actual treatment, as well as any counseling that would be post-visit. So realize that acupuncture visit, when you do just acupuncture, you are doing all three of these, hence why it's generally not appropriate to bill an exam daily. The codes 97810 to 14, which are the standard codes for acupuncture, include a pre-service and post-service evaluation that is considered a component of the acupuncture service. So keep in mind that acupuncture does not allow you to bill an exam daily because there's an exam associated with what you do. Any additional evaluation and management services may be reported, but only if a separate condition or a significantly separate identifiable service, E&M if you will, above and beyond which is associated as the usual pre-service and post-service work. Now, this is not my opinion. This is directly from the CPT as it's defined. There's a pre-service and post-service, actually pre, intra, and post. So let's define what is included in the acupuncture and hence why you can't bill one daily. It's likely going to include some of the following things just in the pre-service. Reviewing the patient's record, taking a quick moment to look at what's going on, obviously taking an interval history. How are you feeling since last visit? It will include, of course, all the preparations for care as well. That's what you're going to do before you even probably touch the patient. Now, once you start touching the patient, you're going to do more, but just one more pre-service, communication with other providers if necessary, not common, but possible. Now, what happens when you put hands on the patient? Well, that's what we call the intraservice. This is going to be your specific pertinent evaluation and assessment of the patient. Maybe tongue and pulse, maybe range of motion. There might be lots of things you do as a traditional medicine provider that you assess the patient. This is simply part of it. It would include discussing with the patient. Maybe you're changing the treatment plan a bit. Maybe you want to evaluate and add different points and explain why. So it includes that. And of course, it includes doing the acupuncture. Now, the acupuncture includes doing everything associated, which means washing your hands, cleaning the points, choosing the points, but of course, inserting, stimulation, and even removal. Also included here is just a monitoring of your patient. Often you might insert needles and you're going to stay and watch the patient, see how they're responding, skin tone, eye color, you name it. But again, that's still part of the intraservice. Realize that you cannot use retention time as your face-to-face. So by example, if you put needles into a patient and leave them to rest for 10 or 15 minutes, that's perfectly acceptable and probably typical. That time simply does not count as face-to-face because you're not doing something actively part of acupuncture. The needles are just doing their work. So that's the service part. But then what about the post-service? Well, post-service includes, after removing the needles, having the patient sit up, evaluate their progress as a result of today's treatment, and probably some discussion with the patient or counseling. Maybe you're going to tell them about sleeping more hours, eating something different, drinking more water, and so on. So there's always a little bit of counseling included. It, of course, would include documenting the services as well. And then any necessary arrangement with referral or other providers would be included. So in other words, the acupuncture code includes a lot of things. It includes that day-to-day evaluation, how you're feeling, and hence why we can't bill one every day. So be very adamant. It is not appropriate to bill an E&M code or quote unquote an office visit every day because of the inclusion to the acupuncture codes. However, what I want to make an emphasis to is making sure there's an understanding of why. Well, the why is the pre-service, intra-service, and bear in mind, generally the level of a 99212 or maybe even a 213 are already included in the acupuncture, because that's generally 1 to 6 bullets if you're familiar with the E&M system for the 1997 guidelines. And those are just bullets, are just the exam things. A bullet would be doing the tongue, doing a range of motion, looking in the patient's eyes, palpating tenderness. Those things up to 11, actually, it's a 1 to 6 is the minimum, is inclusive. So when is it appropriate to bill an E&M on a subsequent visit? Well, let's go through these issues. Number one, and I think this is obvious, an initial examination. That makes sense. Of course, you can't treat a patient without doing an exam, so that's acceptable. Number two, re-examinations, but not just daily, but the routine ones that are done about every 30 days or once a month. If you were treating someone once a week, this would still fall into this because that's your plan, is once a week if you're going to treat for a month. So again, be careful. Just because you're seeing once a week doesn't mean you're doing above and beyond what you would normally do. Number three, this could happen. What if the patient has a sudden change in symptoms? They have some severe new complaint or complaint that's a little bit different from before. That certainly could warrant an examination and a change in treatment plan. Is this common? Probably not, but that certainly could be a reason. Number four, a new incident. Now, this one I think is obvious, but also one that you may run into. You might have a patient that comes in, has a headache. You treat them for a couple of visits. The headaches are doing really well, but on the third visit, they say, "Doc, can I talk to you? I'm having a lot of low back pain since last night." Clearly, that is a new incident, new complaint. Therefore, an evaluation on that day would be appropriate because you're not evaluating the areas you've already treated, but something new or distinctly different. So those are obvious. Some other areas where this could come up, disability status. If you have to change someone's disability status, it certainly will require an evaluation, because how do you know what their level of disability is without a full exam? Is that typical for acupuncturists? Not likely, because unfortunately acupuncturists don't do disability, but it's certainly possible. How about a significant deviation in treatment plan based on new findings? That's possible. Is it typical? No, but the difficulty is, what's the deviation of the treatment protocol? Going from 2 sets to 4 sets is not a deviation in treatment protocol. So therefore, I doubt this really is going to fit very much. But again, I always will say possible. Number 7, what if the patient's just not responding? You're treating for 2 weeks, 3 weeks, and they're just not making any improvement, which of course the expectation is within 3 to 6, we should see a good change. This could be a time for an exam, because possibly the patient may need a referral, or maybe we need to refigure out, maybe we are looking at it wrong and need to do something different to the area. Number 8, what about a dismissal exam? That makes sense. Personally, or most commonly with a personal injury, auto accident, or workers' compensation case, because on both of those, often you have to give a final disposition of the patient, their level of need for future care, their level of pain, the level of care that they may need in the future, not just from you, but possibly from other practitioners, or even the use of medications and so on. Not that we're saying we're recommending medication. But a dismissal exam is not typical, but potentially on a personal injury. A regular Blue Cross Blue Shield, I doubt it. But here's an area where I think we miss, and this is the part I want to deal with specifically when we talk about evaluation and management. The management part could be counseling and or consultation. Now let's define that. Counseling or consultation with your patient, other than that, is usually provided during a routine visit. So I do want to clarify, it is appropriate and common to do a little bit of counseling with your patient, or quote unquote consultation, each and every visit, talking to them about maybe some dietary changes, sleep habits, other habits around the house, changing posture. That's included in the day-to-day. However, what if this is something that fully exceeds that? So here comes directly from the CPT manual. When 50% or more of an E&M visit time is spent counseling and coordination of care, time spent dictates the level of coding. So now what are we talking about? We're not saying you're doing an E&M, but remember, the acupuncture code includes part of an E&M, pre, intra, and post. So if you spend 50% or more of the visit doing that, meaning counseling, it certainly could count. It's what we call the 50% rule. In this case, time is the driver and the key controlling factor. It's not the number of bullets, it's not taking a history, it's literally the counseling time. The extent of the counseling obviously has to be documented in the medical record, and I'm going to implore you, make sure you give me the highlights of what you counseled the patient about and the time you spent face-to-face. This comes from the 2019 CPT Professional Edition. And my apologies, I have a typo at the bottom of this. It says 2019 PT. Please note that's CPT, meaning current procedural terminology. And I want to specifically note it comes from page 10 of the 2019 edition. So it's very important for me whenever discussing with acupuncturists to make sure we're following rules as they have been dictated, not by someone's opinion. So this information I'm giving you here is not my opinion. It is the E&M code's purpose that when you spend 50% or more of your time, you may bill an exam, if you will, or a management code. And that's where I get the management part. And E&M is both. So here would be the example. A patient comes in and you treat them for 30 minutes. You'll notice here we have 97810 and 97811, which is going to be for 2 sets of acupuncture and 30 minutes face-to-face time. But on this visit, post-treatment, you spend an additional 30 minutes face-to-face with the patient counseling them. And again, it could be all those various things. In this instance, because you have spent 50% or at least equal to the acupuncture time counseling, you may bill not only for the acupuncture, but also for an E&M code commensurate with the time. The CPT code 99214 evaluation and management says a suggested time frame of 25 minutes. Therefore, this would be the appropriate code to code for 30 minutes of counseling. Do note it has to be 50% of the visit and above and beyond. The complication here, though, comes from what if I spend an hour with a patient? Now, here's where I want to be careful, and this is where likely this doesn't work too often for many practitioners. If you were doing 3 sets or maybe even 4, that means you are spending 45 minutes to an hour just delivering care. Therefore, to count for counseling, you'd have to spend equal to that time. Frankly, even 30 minutes might be a bit of a stretch because often you may not spend 30 minutes counseling, but there's certainly during a long course of care, a chronic patient, it could happen. So remember, the counseling must meet 50% of the total visit to count. So if you're doing less than 50% on counseling, it doesn't count. And so be careful. Again, would I say this is typical? No, it is not. But again, it does occur. What if a patient comes on a visit and on today's evaluation, you decide not to do any care with them, but you want to go over dietary changes, lifestyle changes, things for them to do at home? What if on that visit you didn't do any treatment? Then you would code that treatment as a counseling visit, meaning 99213 or 214, depending on the amount of time, because it is counseling. This is why you'll notice medical doctors pretty much bill evaluation and management codes daily, not because they're examining, because all they do is manage. They don't do treatment. Being that acupuncturists do treatment, that is the reason we have to meet the 50% rule. And bear in mind, this is the whole reason for modifier 25. When you put a modifier 25 on the exam code, you are indicating that this exam is above and beyond what is normally associated. Obviously, the first 8 reasons I gave would be specific reasons for an exam, but the 9th one for counseling could be it as well. You do not have to meet any of the bullets for it. It's simply just the time. So be careful. With the American Acupuncture Council, of course, do help you with audits. And one of the audit areas I've had difficulty dealing with is making sure that I can show that it's appropriate when they've done it. If you can document those reasons, it certainly is appropriate and certainly reasonable to bill it. But be careful of being overzealous. Don't code something you can't back up to see that's done for sure. The good news is acupuncture works well, and we're going to treat a lot of patients. Certainly within that, you're going to do a fair amount of counseling. And I suspect if you're doing 10 or 15 minutes, no big deal. But all of a sudden, if you're doing 30 minutes, I want you to see whether or not is that time valuable, which it is, but I should say valuable in the sense of being able to code it. So I thank you for the time. Again, this is Sam from the American Acupuncture Council. Here's our website. And I do want to make sure you note, if you always give, you will always have. And bear in mind, acupuncturists always are giving, but you got to make sure also you are running a business. And on the business side, we have to make sure we're documenting things properly. And that's why we bring you these shows, to make sure you're seeing all aspects. I'm your coding and billing expert, Sam Collins. And next week's show, the host is going to be Virginia Duran. And I thank you for spending time with me. And again, a very prosperous new year.